Hello, good afternoon. Welcome to our live stream Facebook event. Give us a moment while we troubleshoot and make sure we're good to go, but I think we're streaming live. We are here on Main Street in Mayville, Wisconsin, and we've got some exciting news for Legacy Medical Services and Mayville Family Practice that we want to share today. During this live stream event, we want to encourage you to feel free to chat questions that you may have. We'll try to get to any questions that come in before the end of our time. You can use the chat feature. But now I'm going to turn it over to Dr. Sammis, who's going to talk a little bit about his exciting news and transition.
Hello everybody from Mayville Family Practice. As you probably are aware from the letters and email that I'm going to be retiring. To reiterate some of the things that I mentioned in the letter, going to have a little more fun now and do some catching up with my family. And I'm leaving in great hands with Dr. Miller here. And I just want to let you know something real quick. When I was his age, I looked like him. So see the hair, the dark hair. Now see, when he gets my age, he's going to look like me. So it's going to look pretty much the same.
It's coming soon.
Yes.
Well, thank you, Dr. Sammis, and just probably a lot of the people joining this virtual meet and greet are Mayville Family Practice patients, because we wanted to give you an opportunity to have a chance to meet me. Obviously, all of you know and have loved the care from Dr. Sammis in recent years, and it's only fair for you to have a chance to meet me if you prefer. So I'll tell you a little bit about myself. I am a Wisconsin native. I grew up in Waukesha. I did my medical school and both my undergrad and medical school at the University of Wisconsin in Madison. And then I went to my family practice residency in the Medical College of Wisconsin program at St. Mary's Hospital, actually in Milwaukee. Following that, I moved my family to Beaver Dam, Wisconsin, and started my practice there. I worked for the university in their family medicine clinic in Beaver Dam for 17 years. And then for the last 7 years, I have had the opportunity to work in this new model called direct primary care. And what I have done for the last 7 years was work with a large company based out of Denver, Colorado, that was really growing and promoting this new model, but specifically for employers. So all over the country, I served as a medical director and traveled around the eastern half of the country, helping to promote and sell this model. I continued to have a practice locally in this direct primary care model, but really serving exclusively one client. And I helped train and hire new doctors to this model. But this past summer, I decided it was time to kind of venture away from that larger company and really do it for myself in my own community. So this summer, I started Legacy Medical Services in Beaver Dam, and have been doing that for the last 6 or 7 months. And then just a few months ago, Dr. Sammis approached me and said he was looking to retire and was looking for someone to take over his practice. So that's a little bit about my background, and I think what's interesting is Dr. Sammis and I have talked and got to know each other a little bit. In fact, we met, 3 years ago?
Yes.
Close to that, when you first moved in here. I had my practice for the client I was serving right down the street in Mayville, just a block down. So I stopped in and we met each other. And
Yeah. He was gracious enough to come over. We had an open house, and a lot of the community came by, and he really stood out. So I always remembered that. So that was good.
Yeah, so he contacted me shortly, a few months back, and said he was, really looking to retire. But I think what's so interesting is your history, and maybe you can tell the listeners a little bit about why you started Mayville Family Practice and just your kind of moving from traditional medicine into direct primary care.
Yes, traditional medicine has changed so much, and unfortunately, as I've probably talked to many of your patients about how I feel about corporate world now and the way medicine's going, which is unfortunate. So this model of direct primary care, I think, is going to be our saving grace. I think it's going to explode in the country, and I think it's going to be getting back to the roots of what medicine should be. Again, it's supposed to be about the patient, and that's number one. And if you have a good doctor-patient relationship, I think that's worth its weight in gold. But I think what we're seeing now is that's going away, and if you go to any of the corporate entities in the area, I think you'll see what I'm talking about. And it's unfortunate, but it's getting too expensive too, and this model makes it reasonable where you can actually get great quality health care for a reasonable price, and you're going to be, I think, very satisfied with it. You know, I always go by this, you know, if you have something that works and you know it's working like it has worked here, I think it's a thing that you just can't say that you can just stop. And like I said, when I was thinking about retiring, I could not really, in my mind's eye, really do that without finding an excellent doctor to replace me. And knowing Dr. Miller and his philosophy, I think he's like me. It's about the patient. And like I said, the old adage, do no harm, do no financial harm. You know, and this is the whole thing with this model. And if people really did care about themselves and care about how their health is, this is the model to do. I mean, it's the bottom line. I think Dr. Miller feels the same thing I do on that part. So anyways, I'll let you take over. I'm talking too much.
No, I think that's what I think resonated with me immediately is just your style of practice, your values, your desire for patient-centered care is so important to me and resonates with me. And so that's what we've talked a little bit about the timing of all this is, things happen for a reason, and it was just very unique timing that I had decided to go out on my own, and yet, of course, in the midst of a pandemic, it's been a challenge to try to deliver health care, to try to get patients to make a switch, and so I was in the middle of working through that and struggling and growing my practice in Beaver Dam, but with the idea that I might want to expand to Mayville someday because that's where I've been practicing for the past 7 years, and I had relationships here. And so to have you call me out of the blue and say, hey, I'm looking to turn this over was perfect timing for me. But a little bit about, why did I leave the practice I was in and that role was really for the same reasons. I could see that the company I was with, and we had been purchased by a venture capital firm, and it was becoming more corporate, even in a DPC fashion. And for me, I knew that what was important to me was being able to maintain those relationships with patients and be able to deliver high quality care in a way that made sense for them. Healthcare has gotten so kind of off track in so many ways. And it's sad because the ones that really get hurt by it are the patients. But as we've both seen in our careers, physicians are very frustrated with it too. They're getting burned out. It's not as satisfying as what they thought they were getting into medicine for because the relationships are being undermined by the system.
That's exactly right.
One of the things I've seen, and I talk to patients and businesses about this all the time, is that unfortunately we put up so many hurdles for patients to just access the care they want.
That's right.
And it's insurance companies, and it's large systems that don't have the availability, and it's
just the cost.
And the cost, and prior authorizations, and long wait times. And so what I love about this model, and my You know, the three things I say I'm trying to do with my practice is provide a better experience for patients, provide better health outcomes, because when you can spend time with people and really understand their needs, you can help them get to a better place health-wise. And finally, better value. And it's amazing what you can do when you directly contract, and really the direct primary care model is a direct contract between the doctor and the patients. And you kind of cut all the middlemen out of that relationship who want to, you know, extract profit and control things.
That's right.
And it allows us the freedom to say, I can spend my time focusing on patient care and being with my patients and helping them solve their health issues rather than billing and documenting and, you know, chasing down coding and all the other things.
And trust me, that does not improve healthcare at all. It just makes it more complicated, more expensive, and that's why people are so frustrated.
Mhm. And I think the thing is that we're trained, you know, in medicine to deliver high quality care. And I know, you know, both you and I believe strongly in that, and you can do that, it actually defeats that when you spend your time on administrative things rather than really listening to the patients, understanding what they need,
Exactly right.
investigating their problems. So that's what I love about it. I have a couple of philosophies kind of in my care and in my you know, vision and mission and purpose statements that I've developed for my business. And one of them is, there's three ways or three philosophies that I try to treat all my patients with. And the first is relationship-centered care, you know, meaning that, and I know you practice this way, that it's about building a relationship with patients, one that they can trust you, you can trust them, there's mutual trust that goes back and forth, and when you do that, you're able to get to a much better place quicker in terms of understanding them and their needs and helping them.
Yep.
I believe in kind of healthy whole, which means, you know, people are not just a set of chemicals, right? They have an environment they live in, they have relationships, they have stressors, they have emotional and spiritual and other parts of their being that are important, and they're very important in our health as well. So I believe at looking at all of that and helping people get, it's not always just about prescribing a pill.
That's right.
And finally, I'm really passionate about giving patients better value. And there's so much you can do in healthcare these days to get, and we've talked about this, it's just crazy how you can get people medications and lab tests for a fraction of what they're used to paying or what the insurance company's charging. And we always look for ways to do that because it's their money and they're spending their hard-earned dollars to try to get health care, and it should be as affordable as possible.
That's exactly right.
And both of us, I know your practice and mine, have always believed in transparency. So, you know, there's no hidden prices. You can ask us and we'll tell you what it's gonna cost up front. You know, that's what you should expect from healthcare. So that's a little bit about my philosophy. Just curious, I'm sure the Mayville family practice patients are curious to hear a little more from you about what's your plans with retirement? What are you gonna do come February 1st?
You know, it's going to be a shock to my system, I think, number one. But, you know, the thing that I have a lot of catching up to do. I have a lot of things that I think through my life that I was kind of nearsighted, and I didn't really see what was happening around with my family and friends, and you know, medicine can be very consuming, and you know, you want to try to do the best for a patient. When you do, it does take time, it takes a lot of effort, and things that you don't see behind the scenes. So these are the things I'm going to be doing. So number one, oh my gosh, canoeing. I got some camping trips I think planned up in Canada, and I mean, I think I'll be more busy doing those type of things, which to me seems like a dream. And if it's a reality, I'll be amazed. I like to pinch myself every day. But beyond that, though, you know, I've been blessed. I could tell you over and over again, you know, with the patients I've had and through the years of practicing, I always say that we get guided, and this is what happened with this. And Dr. Miller was, I think, an answer to my prayer, but I think it'll be an answer to your prayers too. So,
Great. Well, I think we can open it up if people have any questions. There is the live chat feature, and we can do that. But before we do that, I just want to make one other comment that our desire for both of us, I know, and Katie, who's staying on as the nurse, so that's fantastic. She's hiding in the corner, but she has obviously been a huge asset to Dr. Sammis, and I'm sure will be to me as well, to provide continuity, and I know the patients know and love and count on her. So, but our desire is to make this transition as smooth as possible. It's hard when you have to change doctors and get to know someone new, and that's difficult, and I think we both understand that. So we want to make that transition as easy for the patients as possible, and so I'm committed to trying to not change too many things, obviously, right off the bat. There'll be a few things. The name will change on the sign out front at some point to Legacy Medical Services. I will have 2 locations. I will have one in Beaver Dam and one in Mayville. So,
can I ask you a question? Why is your practice called Legacy Medical Services?
Great question. Yeah, I thought long and hard as I was thinking about starting my practice of, what to name it. And I landed on Legacy because I kind of really boiled it down to, what am I trying to accomplish with this? And I think what it was, at its heart, was I wanted to be able to leave a legacy of really good quality healthcare to my own community. And, that's everything from, what I pass on to my children someday, but really something that outlives me is my hope. And it's kind of interesting because I think it's, that's obviously what Dr. Sammis was looking for, was someone that could carry on this tradition, and he didn't want to just close up shop. And so for me, I hope that when my time is to retire, which I think is quite a ways off, I believe, but when that time comes, I hope to, be able to pass it on to someone. My secret desire is, my son's currently in medical school, and I'm kind of secretly hoping he chooses family medicine and, may want to come and practice in the family business, but we'll see.
Sure.
He's early on, so he's got a few years to go. But I do want to leave a legacy of good quality health care for my community. So, but just so patients know, particularly Mayville family practice patients, we're gonna, the phone number will stay the same. You won't need to get a new phone number. The fee schedule, the current fee schedule is going to stay the same for this coming year for certain. We'll have regular hours. The access you're used to, being able to get a hold of Dr. Sammis, will continue. I have in my system, I have ability to securely text me. We'll use the same electronic health record. All your records will transition, and so hopefully you won't notice many changes, but obviously you have to get to know me and come to trust me in my care. I think you'll find it probably pretty similar to Dr. Sammis' style, but feel free to come on in, say hi, ask questions. In-person meet and greets are fine too, and we're happy to schedule those. But you will be getting either an email or a letter soon, within the next couple of days, just explaining the transition of care and basically asking you to acknowledge if you're going to continue with the practice. Obviously, everyone has the right to opt out and choose to go get healthcare elsewhere, and we will be happy to help you transition records to another practice if you so choose. But I hope you take the opportunity to come and get to know us, and we are looking forward to caring for you. So, Katie, I don't know if you have any questions that have come in.
Yeah, so the first one says, do you agree with a parent's right to choose certain medications and treatments? Specifically, do you have a problem with parents choosing to not vaccinate their children?
That's a great question, and I will say that my overall philosophy is about patient autonomy, right? My job as a physician is to use my experience, my scientific training, my expertise as a clinician to help guide you in your health. but ultimately patients have autonomy to choose what they want. And so I absolutely respect individuals and parents' rights to choose what they want to do for their health. And my job is to help educate you and give you the evidence and guide you in what I think might be the best for you, but at the end of the day, it is your choice what you choose to do with your health. And it's actually a really important part of that relationship is
Yes.
that, I'm here to be an advocate and a partner and a guide and an educator, but you can only really achieve better health if the patients engage in it too. If they take their health seriously and want to figure out what is best for them, that's really important.
I think you kind of answered the next question. It was, do you support parents' values medically even if they aren't aligned with yours?
Absolutely. And again, back to the fact that we talk about I use the term relationship-centered care because it's a little different than the customer service world where the customer's always right. That's not always the case in healthcare because obviously we have certain expertise and training. And so I expect patients to also respect my rights for certain things. For instance, sometimes patients think they need a certain medicine, and if I know in my experience that it's not the best thing for them, I'm going to tell them that. And I have the right to say I'm not comfortable prescribing that, and that's always, and I'm sure Dr. Sammis has the same approach. But it's about a conversation and helping people understand why I feel, based on my clinical experience, that might not be the best thing for them. And I'm always going to default to what I feel is the best for them, at least in my advice and my education to them.
Yes.
Okay. Do you support the use of natural treatments before medications?
Absolutely. I think I guess I've always described myself as an evidence-based physician, but not a pill pusher by any means. I always believe that if there is a better natural way to treat something, I think that's always better for our body. Now, that being said, some people have the mistaken understanding that if it's a natural product, it doesn't have any side effects, and that's not always true. Some of the natural products have some significant risks to them as well, so my goal is to help people understand that and talk through that with them and make sure that they're taking a treatment that has the best balance of benefits versus risks and trying to understand what those are.
We have a patient who asked online, what will the hours be at each location?
So initially what we're going to start with is I will be in Mayville all day, and I think, what did we say, 8 to 4:30, Kate, you ready?
Yep.
Is that what we said initially? 8 to 4:30 on Monday and Thursday every week. I already have existing hours in Beaver Dam all day on Tuesdays and Fridays. And then my Wednesdays will be flexible. So I try to take some time to have administrative time and be able to do the business side of things. But the beautiful thing about the DPC model, I think, is that I am always available to my patients. And so if someone has an urgent need, I absolutely will try to meet that need. And whether that is just by phone or a video visit, or if you need to be seen in person, I will do my best to accommodate that. And that means I have to drive to Mayville on a Wednesday. I have no problem doing that.
I have another question online. What hospital or hospitals will you be associated with?
Another nice thing about DPC is our independence, right? We are not part of a health system, which means we don't have any requirements or obligations or pressure to refer patients to one system or another. So I have certain specialists that I have developed a good relationship with and I trust, so I tend to steer people towards those. But I'll also gladly work with patients' insurance and needs and locations. And so I have, in my practice in recent years here, I have referred patients for specialty care and to hospitalization at, Fond du Lac and West Bend and Beaver Dam and Ripon and Waupun, and so all the surrounding area hospitals we used. My model, as I think yours was, is strictly outpatient. I think it was provided inpatient care recently to when patients do get hospitalized, but all of our systems around us have hospitalist programs where they have dedicated full-time people caring for inpatients. one of the ways we deliver better value is try to keep people out of high-cost healthcare. And so I always encourage my patients, you know, if you think that you might need to go in for urgent care, emergency room or something, encourage you to call me first, because often we can help you navigate that and decide, is that necessary? Obviously, if it's something life-threatening, you know, don't waste time getting a hold of me. You know, call the ambulance if you have to. But a lot of times people just need some advice or to help understand, is this urgent? Do I need to go in tonight? Can I wait and see you tomorrow? And we're here to help you talk through that and figure that out.
Yes.
Another patient had a question, if I have insurance, am I allowed to join?
Absolutely. I always say we're agnostic when it comes to insurance. You can have any insurance. We do not bill insurance, and that's the direct primary care model. So everything we do in the office is covered by your membership fees here. So if you need something outside of insurance, we can refer you to that, whether that's a specialist, whether that's a imaging, whether that's outside tests that need to be done, and we can refer that within any insurance model or network. We just don't bill insurance for our services.
Kind of two questions I'm going to put into one. What patients are you comfortable treating, and do you see children?
I am comfortable with pretty much all ages, and my experience over the last 20 plus years in family medicine has been, I did OB for many years. I love taking care of young children and families. I've done quite a bit of geriatric care in the past. In fact, I used to run the Dodge County dementia clinic for 10 years, and so I love caring for those patients. There are some tricks with Medicare and this, so we're working through some of that, but I am comfortable with all ages and the full spectrum of family medicine, which I think is your practice. Acute care needs, prevention, wellness, child visits, adult physicals, female health care needs, chronic disease management, all the typical things, diabetes and hypertension, hypercholesterolemia, and a lot like Dr. Sammis' practice, I enjoy doing office procedures, and whether that's, you know, lumps and bumps and moles and cysts and those kind of things, laceration repairs. I love doing that stuff. So.
We got about 2 minutes left, and one last question. Do I still need to see my cardiologist if I join your practice?
Great question, common question. You know, what about my specialty care? You know, we don't do direct primary care to disrupt those relationships you have, but what a lot of patients find is that in the big health systems, they just get, you know, pushed to the specialist because their primary care doctor in that system simply doesn't have time to deal with that. The nice thing about this model is we do have time, and so I am happy to take over care that is within my scope and comfort level as a family physician. And a lot of things, what I found a lot of patients, they're, you know, going to see the cardiologist every year simply to have them write their prescription. We can often take care of that and save you a trip and the cost associated with that. What I always say is, if I ever feel like you need to see your cardiologist back because something's going on, I will absolutely send you. But you don't need to see him often just to get a script written each year and, you know, have the 2-minute visit. So.
Well, I think that's all for the online questions. There's just some patients wishing you well, Dr. Sammis.
Well, thank you.
And I'm trying not to get teary-eyed. And they're happy that I'm staying on, and they are excited to meet Dr. Miller.
Well, I tell you what, like I said, to me, it's still not real, and it probably won't be real even after a month from now. But you know, what can I say? You know, it's. I don't want to get choked up here, so I better not say a whole lot because I won't make it through it. All I gotta say is that I'm leaving the practice in really good hands with Dr. Miller, and I think you'll be more than satisfied. As I told you guys already, he's much smarter than I am, and so you'll do great with him. But you know, remember, in the people who are on the fence about maybe you know, going somewhere else, you know, I challenge you, if you did do that, remember what you had and why you stayed here. If you go back and you get your 5 to 7 minute visit and you gotta pay your huge copay and you're gonna be a number again, if you think that's what medicine should be, then I think, but you're gonna be treated like people here, and you're gonna be, you're gonna see the value in it over and over again, and it's something I think that as time goes on, you're gonna see your health markedly improve compared to what you see elsewhere. So, and I don't wanna say any more. I'm not gonna go off from the other part, so, but again, thank you very much.
Well, thank you for your endorsement, and I know that, you know, Dr. Sammis, you know, a hard decision to retire, but also the hard decision of, you know, turning down other people who wanted to take over the practice and do it in a different way or move the practice somewhere else, and he chose to really value the patients and the patient care, and, you know, kind of waited around until he found what he thought was the right fit, and specifically for his patients. So I really respect that. I'm hoping that, you know, I might coax him out of retirement occasionally to cover for me if I have to, you know, go out of town. So you will.
And,
you
and
might see
I
me.
might do that. I get bored after a while. Okay, I caught enough fish. Do some
That's right.
things.
You could see him occasionally covering a week for me or something, but we'll see. But thank you. I look forward to meeting any of you who I haven't met yet. And like I said, come February 1st, everything should look about the same, but you'll see a new face. And if you want to schedule an appointment, if you want to schedule just a meet and greet in person, we're happy to do that. And just call Katie. She's got the schedule open already. So I look forward to meeting many of you, and thank you for joining.